So everyone talks about gluten. Gluten's a hot topic, and gluten intolerance, gluten-free, this and that, whatever. The lowdown on gluten is it is inflammatory. You should try to avoid it. If you don't have a gluten intolerance, this may not apply to you. But with that said, gluten is pervasive in a lot of the foods we eat, and including the breads, the crackers, pastas, so on and so forth. And what gluten does to the gut specifically is it is partially inflammatory. And the reason why is in our gut, we have a one cell lining thick layer between our gut and our body. And this is the digestive tract. And that digestive tract houses the microbiome, the bacteria that helps with our neurotransmitters, our mood, our immune system, so on and so forth. And what high levels of gluten and inflammatory molecules of gluten do sometimes is they break that barrier up. Kind of like a brick wall on concrete, the concrete is opened up. The gap between these cells, the digestive cells, is called the tight junctions, and they're regulated by a molecule called zonulin. And gluten affects this regulation of this permeability. So everyone's heard of leaky gut. Part of the reason why that term exists is because of this tight junction molecule interaction. And dietary measures, including lowering inflammation through a less gluten tolerant diet, or I should say, limiting your gluten consumption, definitely helps with inflammation overall, and that obviously affects your foot and ankle pain and inflammation that you might see there. So again, we try to treat the whole body, not just the foot, and this is part of the reasons why we want to talk about diet today.